Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what is the treatment of age-related macular degeneration? In the age-related macular degeneration, that is wet or exudative age-related macular degeneration, we have three things. One, it can be extrafoveal. Extrafoveal age-related macular degeneration means it is present more than 200 micrometers from the center of foveal avascular zone. So if this is the macula, so in the macula, this is macula, we have fovea. Okay, inside the fovea, we have foveola. Okay, above outside foveola and inside the fovea, we have foveal avascular zone. Okay, then from 200 microns from the center of this foveal avascular zone, you will see 200 micrometers, and this is called as extrafoveal region. Okay, then if the age-related macular degeneration is present in this extrafoveal region, then laser photocoagulation is done. Then we have juxtafoveal region. In juxtafoveal region is actually not involving the center, but it is closer than 200 micrometers. Actually, sorry, this is, okay, this part, if you see this part, sorry, here when do you call this as extrafoveal is, so this is 200 micrometers away, this part, the whole part above or more than 200 micrometers, this is extrafoveal. Whereas the part which is closer to the 200 micrometers but not involving the center, that is this part, which is closer to the 200 micrometers and not involving the center, is juxtafoveal part of age-related macular degeneration. It is actually closer to the 200 microns but not involving the center. So here if it is present, then we do a laser photocoagulation or photodynamic therapy can be done to the patient with juxtafoveal age-related macular degeneration. If the age-related macular degeneration is in subfoveal region, which is involving the foveal avascular zone, in such cases we should do photodynamic therapy is needed. So this is actually involving the center of foveal avascular zone. So this is age-related macular degeneration.
thank you and thank you for watching.